Hi, it's Hannah here from Physic Health Consulting. My topic for today is perimenopause and COVID because this is something that I've been very interested in for the last year or so. So about March 2020, the COVID Zoe symptom app was asking questions about menopause status in women and trying to establish whether there was a link between menopause and getting worse COVID infections. And certainly in my practice over the past year, the vast majority of long COVID patients that I've seen have been women aged between 40 and 50, which is obviously prime age for perimenopause. And then we've also seen this kind of very strange perimenopause long COVID combo situation where it's really, really difficult to unpick which symptoms are perimenopause and which are long COVID. And it's quite a tricky, complex symptom picture. It can take quite a bit of undoing, quite a bit of work to get it straight again. So over the past year or so, studies have shown that in fact, we are at higher risk of getting serious complications from COVID post-menopause, and there's various reasons why that may be. So estrogen has a protective effect upon our immune system. It helps it to work more effectively. It also helps to protect the tissue that lines the lungs and physically stops the virus from getting in the first place and doing the damage. And also histamine levels in women, if they're a little bit higher than they ought to be, that problem can get worse around perimenopause. And we know that high histamine levels are implicated both in serious COVID infection and in long COVID as well. So it does look like taking HRT post-menopause can help to protect us against this, but at the same time, some women can't take HRT or don't want to do that. So what are the options for you if this is the case? There may be some benefit to you taking herbs which contain phytosterols like phytoestrogens because they have a weakened estrogenic effect on the body, which may help to have a similar effect again upon the immune system and the lung tissue and so on. That has not been studied. We don't know that for sure either way. And to be honest, it's probably not going to be looked at closely by the scientific community. What we can do, because there's always a bigger picture, is help support your body in other ways. So we can use herbs which physically strengthen the mucous membrane. So that's the slimy skin you've got in your nose, throat and lungs to help strengthen that barrier against the virus coming in the first place. We can also give herbs that help to strengthen your immune system and make you more robust against infection. And then if you do get COVID infection, we can still give herbs that will help you to fight that off and cope with it much better. And I have done this a few times in my clinic over the last year or so very successfully. If this is a particular concern for you and you would like to discuss it a little bit more, please do get in touch. There is probably a message me button here or here somewhere so that you can send me a message and tell me what's going on for you. Otherwise, you can book yourself a free call online on my website, which is at www.physichealth.uk. If you've enjoyed this video and found it useful, I'd be really grateful if you could like and share it for me. I'm Hannah from Physic Health Consulting, and I will see you again soon. Bye.